Hi, I'm Dr. Jared McDaniel, and today we're going to cover 7 common questions from breast reduction operations. Our patients have the ability to send questions to us through our website, www.gallatinplasticsurgery.com. Today, we're going to answer 7 common questions that patients have about breast reduction operations, or reduction mammoplasty. Breast reduction has the highest satisfaction of any operation in plastic surgery. About 97% of patients say that they would have the operation again. The reason for this is threefold. Number one, patients tend to have complete or near complete resolution of symptoms related to breast size after surgery. Those symptoms can include back pain, shoulder pain, neck pain, shoulder grooving, rashes underneath the breasts, migraine headaches, as well as several others. Breast reduction is very effective at getting rid of those symptoms. The second reason for the popularity of breast reduction is the fact that breast reduction has the same aesthetic effect as a breast lift operation, which is a cosmetic operation. The two operations are very, very similar in the way that they're done and in terms of the results, in terms of lifting up the nipples and areolar complex, resizing the areolas, and reshaping the breast. So in that sense, the cosmetic benefit is very good from the operation, even though that's not what you're looking for specifically. The third reason has to do with discomfort, and we'll talk about that with a different question later. Breast reduction typically is not as uncomfortable as patients believe that it will be, even though reduction mammoplasty is a major operation and there is discomfort associated with it. The combination of the fact that there aren't as many nerves within breast tissue as there are within many other types of structures within the body, muscle, bone, etc., and the fact that I use a long-lasting injection of numbing medication that lasts for about 3 days after surgery. The combination of those two factors tends to decrease the amount of discomfort after the operation significantly. So it's very common for patients to say, I didn't have very much discomfort or pain, or to say it didn't hurt nearly as much as I thought it was going to. Question number 3 says, what happens if I gain weight after surgery? That's a very well-informed question. Even though most of the time we don't plan to gain weight, it is a reality of life that sometimes that happens. In breast reduction surgery, the effect of weight gain depends on whether or not your body is the type that gains and loses weight in your breast or not. Some women will say, ever since development, ever since I can remember, my breasts have been the same size, despite increases and decreases in weight. Other women will say, well, that's the first place that I gain weight is in my breasts, and the first place that I lose it. If you gain weight or lose weight, that may not affect your breasts much if you're in the first category, or if you do tend to gain and lose there, your breasts may get larger again. If they do get larger, that skin will stretch out, just as it does in other areas of our body when those get larger. And you may end up with some droopiness of your breasts or requiring another breast reduction, although that is very uncommon. Typically speaking, after a breast reduction, weight gain will be proportional in your breasts to other areas in your body. Will I be able to breastfeed after my breast reduction? This is a common question. I have a lot of younger patients who are anticipating having families. Statistically speaking, we know that there's no statistical difference from research between patients who've had most types of breast reduction surgery and those who have not had any surgery before. So about a third of patients in both of those groups are not able to successfully breastfeed after surgery or just in general without having had surgery. but about 2/3 of patients are able to successfully breastfeed. The next question asks, I smoke. Am I at a higher risk for complications? That's a great question. There are a couple of different things that significantly increase risk with a breast reduction. One of those things is smoking, as we'll talk about, and another one of those things is having a high body mass index. Body mass index is a measurement of the amount of fat content in your body compared with your height. It's not a perfect measurement because people who do bodybuilding will have a higher body mass index, but it's one of the most studied ways of figuring out what fat content is present. With patients who have a very high BMI, and the effects of a high BMI start above 30 but are very pronounced above a BMI of 40, complication rates including infection and wound healing problems tend to increase. Smoking, however, is a little bit worse in the sense that smoking or nicotine use of any kind, whether that be chew or vaping or cigarettes or any other use, patches, gum, that will actually decrease blood flow to tissues that are trying to heal after surgery. One of those specific tissues that has some decreased blood flow by nature of the way that the operation is done is the nipple. And smoking will significantly increase risk of not only wound healing problems, but also loss of the nipples. In other words, nipples and areolas turning black like scabs and falling off. We call that nipple necrosis. Out of all of the breast reductions I've ever done, I've never had nipple necrosis in a patient. And a big reason for that is that I don't do this operation on patients who are using nicotine. So yes, the answer is nicotine or smoking does significantly increase your risk of complications from the operation. And for that reason, it's a very good idea to be off of any form of nicotine for at least 4 weeks before surgery to allow the effects of that nicotine out of your body. Most patients with most occupations are able to return to work within about 1 week after surgery. Now that does not account for some of the activity restrictions that may affect your job, such as lifting heavy objects more than about 15 pounds, or repetitious actions with your upper body. Restricting those things is very helpful to ensure that you have a smooth recovery. Therefore, I restrict you from doing those things for about 6 weeks until all of the internal scar tissue that happens after surgery is as strong as it ever will be in order to allow the shape to stay the way that I formed it during your operation. But for jobs that don't require heavy lifting or a lot of upper body movement, returning to work within a week is usually very doable. Oftentimes patients are back to work within about 4 to 5 days after surgery, but I do encourage you to ask your employer for a week off just to be well prepared for the recovery process. So the last question asks, what will my scars look like after breast reduction? It's a very good question because scars are oftentimes a significant concern of this operation. The answer is that the scars that result depend on what type of technique is used. Most of the time, however, regardless of what technique is used, the scars heal very well. What we hope for is a fine line, relatively thin scar that flattens and fades over time. This process, which is called scar maturation, takes about a year. So initially, up to about 2 months after surgery, scars may be a little bit thick, a little bit red, and then that process starts to improve over the next several months until approximately a year after surgery. With a wise pattern form of breast reduction, which is a very common method of breast reduction, the eventual scars look like an anchor. There is a scar around the nipple and areola, and during that process of making that scar, the areola is resized to a normal size. There's a vertical scar that extends down to the chest wall, and then there's a scar underneath the breast in the fold, which travels horizontally. This technique of the operation allows a large amount of skin to be removed, and so in patients who have very large breasts, I use this technique. However, in most cases I prefer a technique called a circumvertical pattern with a supromedial pedicle. This operation has a lot of other names based on the surgeons who developed it, including Lassus and Lejour technique, Hall-Finley technique, etc. And in this operation, the eventual scar involves a scar around the nipple and areola, as before, and a vertical scar down to the chest wall. There is no horizontal component of the scar in this case. It is important to note, however, that I do not do this version of the operation more commonly to avoid the horizontal scar. Sometimes, if the patient still has a lot of extra skin, I will still add a horizontal component to the scar in order to take that skin out. I actually prefer this version of the operation because in most cases I think that it provides a better long-term shape result because of how the tissue on the inside of the breast is reshaped during the operation. Thank you for watching our 7 questions on breast reduction surgery. I'm Dr. Jared McDaniel with Gallatin Plastic Surgery, and I hope that this was an informative time for you. Please don't hesitate to call our office or visit our website, www.gallatinplasticsurgery.com, for more information. Our cosmetic consultations are free of charge, and we hope that you will schedule an appointment so that we can discuss this operation or any others in much greater detail. Thank you very much.